Hi, Jan.
Is that good?
It's perfect. Thank you. So we might have a few more people coming in, but I also want to be cognizant of our time because we have kind of a lot that we want to talk about today, but maybe not a lot of time. So we'll go ahead and get started with just a welcome. For those of you who I have not met, my name is Joey Uni. I am the director of the Division of Developmental Disabilities. My co-facilitator for today is Julie Hand, who's the assistant director. And then if you look around on various participants, you might see some other friendly faces from the Division of Developmental Disabilities. And hopefully it looks like we're getting quite a few chats with other introductions. Again, because of the lack of time, we're not going to do a formal round of introductions. So please keep monitoring the chat box and we can see who else is participating with us today. Julie's going to walk us through the agenda in just a bit, but I wanted to start with why the Stakeholder Collective and who is the DD Stakeholder Collective. So Jamie, if you are good, we will go ahead and move to the next slide. So why the Stakeholder Collective? You might realize that this is a new approach from the Division of Developmental Disabilities. So we're taking this approach because as stakeholders, we have common goals, we're vested interests, and we share knowledge, right? And so that's important to us within the division. We place priority and value on fostering open and clear communication with people who access services offered, as well as those who provide those services. And we feel that sharing information and asking for feedback on a regular basis is key to our continuous quality and improvement. So who is included in the collective? So next slide, Jamie. All of us. So on this meeting and who we would consider the Stakeholder Collective is South Dakota Advocates for Change, DD Council members, South Dakota Supporting Families Community of Practice members, community support providers, both Choices and Family Support 360, Choices case management providers, Family Support 360 coordinators, and of course, Division of Developmental Disabilities staff. So that is who is in our Stakeholder Collective. How often will we be meeting? We're going to be meeting quarterly. It's going to replace any meeting typically held with each group listed previously during the following months. So obviously this month, July, September, and January. And then the day and time of meetings are going to vary based off of your feedback. I will turn it over to Julie Hand, and she's going to go ahead and walk us through our agenda. So how we're going to spend our time together today.
Hi, everyone. Like Joey said, I'm going to run us through the agenda. So we've kind of explained to you why we're hosting these Stakeholder Collective meetings and who's involved. Want to talk a little bit about the general agenda. Joey's going to give an overview of our Continuum of Care efforts. So that'll include a brief background of the recommendations that were part of the Continuum of Care work and DDD response and actions that we are taking as a result of those recommendations. After that, we're going to have some small group discussion. So I'll be working on putting everyone into a breakout room, and we'll spend about 15 minutes doing that. Before I send everyone in their separate directions, we'll kind of go through some small group agreements and ground rules for those breakout rooms. We'll pull all back together, and then we'll spend some time getting a report out from each group about your discussion. We'll spend a few minutes talking about a couple other events that the Division of DD is planning, and then we'll do some wrap up and announce the date of our next Stakeholder Collective meeting and any other kind of last minute items that might crop up during our time today. So that's in summary what we'll be spending our time together doing. For those of you who might be new to Zoom, just wanted to include a quick slide. Of course, please mute if you're not speaking, and your mic is on the lower left-hand side of your screen. You can access the chat by the little conversation bubble kind of in the middle of your screen. And there's a little reactions button that lets you kind of insert emojis into the chat or give a little thumbs up during a conversation. And you can also change your gallery views. So if I believe it's up in the right-hand corner, there's a little button that says view, and you can change it to just view the speaker or change kind of the layout of who you're seeing and how many people you're seeing during the meeting. Next slide, Jamie. So we have assigned some roles for today's meeting. So Julie Johnson-Dresbach of DDD is our timekeeper. So she'll be keeping us honest and making sure that we spend our time wisely and don't stray off into other arenas, and we're able to cover the topics we came to cover. Donna Deal has kindly agreed to be our note taker today and kind of catch the highlights of our conversations. Tyler Evans is going to be monitoring the chat box. And so as our conversation proceeds, then he'll be kind of calling out things that are entered into the chat box so we can make sure that those are included in the conversation. And Brooke Nelson is going to be keeping track of our waiting room. And I believe we've got everyone out of the waiting room, it looks like, and everyone's actively in the meeting. So I appreciate all of our DDD staff kindly taking on the roles that they have for today. We also have DDD staff and a couple of our Supporting Families community practice members who will be facilitating the breakout rooms when we get to that point. I didn't list everyone because it's a lot of people. So you'll meet them when you get to the room, and they'll introduce themselves to you at that point.
Julie, quick question for you. For anybody who has to leave early, will a summary or this PowerPoint be shared with folks afterwards?
Yes. So we haven't decided a specific spot on our DDD webpage, but we're hoping to post some notes and the PowerPoint presentation. My thought is under our resources section of the website. And I have that link, I believe, at the end of the slideshow. So. Anything else? I think that's the end of my spiel for this afternoon.
All right, thanks, Julie. So next we're going to jump into the Continuum of Care update. So as you can see from the slide, in November of 2019, the Department of Human Services initiated an effort to review the Continuum of Care of services for people with IDD in South Dakota. That project began in January of 2020 and resulted in reporting on gaps in services. The recommendations then to eliminate those gaps were released late last summer in August of 2020. The link there is on the screen. If you have not seen that report, it is out for public viewing at the website listed there. So we're going to walk through the recommendations as well as the Division of Developmental Disabilities responses to each one of those recommendations. So the initial report listed 5 general areas of recommendation. They include the South Dakota Developmental Center, community services, communication, provider capacity, and transportation. So obviously of those 5, the Division of Developmental Disabilities has a large stake in 4 of those. And so that's what we're going to talk about today. You'll see through that we are actively responding to several of those recommendations. So the division is very busy right now with the work that we have in order to ensure we have an efficient continuum of care. So as you can see on the slide, the first set of recommendations we're going to walk through is community services. These are right from the report. So the recommendations made were that we should complete a review of the Division of Developmental Disabilities workload capacity to verify the need for additional employees, that we should consider the development of an ombudsman position, and we should consider creating a board certified behavior analyst or comparable level of behavior consultation services as a service for both waivers, so meaning both family support and choices. Jamie, next slide, please. They also made additional recommendations, which is that we should continue to work with the Rate Structure Review Committee and the CSPs to determine the true cost of providing services. We should also consider re-examining our approach to workshops and community exploration and compare it with what other states' responses are to the federal rule in these areas. So our specific response to those recommendations is that we are reviewing our workload capacity to verify the need for any additional employees. We're also expanding our behavior consultation services as a service for both waivers. And we have continued the rate structure review work via the contracted consultant agency. So that work was really paused due to the pandemic last year. And so just within the last month or so, it's resumed. And so we anticipate that that work is going to kick off again in the next month or so. We are also re-examining our approach to workshops and career exploration, and we're doing so via a work group that we've identified as what's called HCBS settings, which is home and community-based settings, and looking at that with the DD provider stakeholders specifically. And that first work group is going to be held early next month. We're also expanding opportunities to communicate with individuals, guardians, providers, all of our stakeholders. And this Stakeholder Collective meeting is an example of that. The next recommendation area is communication. So the Align report identified several recommendations in this area. To start, the recommendation was to consider creating additional opportunities to regularly engage stakeholders, and to consider developing a waiver manual for both choices and family support waiver as a resource for stakeholders and providers. So our response to that is, again, we are creating additional opportunities to regularly engage individuals, families, and guardians. This is an example of that, as well as listening sessions, which we'll talk about a little bit more towards the end of this meeting. We are also currently developing waiver manuals for both choices and the Family Support 360 waivers as resources. We hope to have the initial draft of those early summer with the release by fall, if possible. The next recommendation area was provider capacity. So the recommendations made in the report were to be consistent with philosophies of charting the life course framework. And that we should consider the development of a model in which services revolve around the needs and desires of the individual consumer. That we should consider the creation of 3 regional centers. That we should consider creating a technological assistance services on the choices and family support waivers, allowing for the use of various technology to provide supports. The recommendations continue to include consider developing a vision of alternatives to SCDC placement, to consider allowing individuals who lack an established support system to access staffing support from a CSP, either temporarily or long-term, and to consider state-sponsored trainings to initiate building provider capacity to serve individuals with the most challenging behaviors. And in that recommendation, they provided specific topics based off of those listening sessions, and many of you were probably a part of those. So these topics might not seem new to you. But they specifically called out these 5 topics. And so that's going to be our target response initially as well. So as far as provider capacity and the Division of Developmental Disabilities responses to those recommendations, we are currently increasing consistency and utilization of the philosophies of charting the life course framework. And we're doing so to ensure that services revolve around the needs and desires of individuals that are supported. We're also considering technology services in choices and family support waivers. Both of those waivers are up for renewal in the next 2 years, family support being in less than a year, and choices being just a few months after that. So that is an active conversation that we are having. Another recommendation that we're responding to is expanding supports to individuals who lack an established support system to access staffing support from a CSP. That is something that we are also looking at possibilities in that particular area. And then we are establishing a state-sponsored training to build provider capacity. There is a state-sponsored training that will occur in September. And then there is additional training opportunities that will be announced through the creation of a training facilitation program, or I'm sorry, position here within the division. And so in the next few months, there will be more information about that, again, with the goal of building not just provider capacity, but capacity across the system. The final recommendation is in regards to transportation. So the Align report called out 2 specific areas in transportation. The first being that we should consider additional funding to support and promote community access. That we should consider a partnership with the public or private transportation providers to develop and implement a subsidized fee program for individuals with intellectual and developmental disabilities. The second recommendation in this area is to consider additional information and education for stakeholders on reimbursement to and from medical appointments via the state Medicaid plan, and to ensure individuals can access and pay for transportation to needed health appointments. And so our specific response to those 2 recommendations is that we are considering funding structures in both waivers to support and promote community access. We're also considering organizing education for stakeholders specific to the state Medicaid plan in hopes that that will help ensure individuals can access and pay for transportation to needed health appointments. So that was a whole lot of information. And I just want to take a minute before we jump into the small group discussions. What is your initial response? If you've already seen the Align report, some of this information might not be new to you, but just you can put it in chat and we'll monitor that for conversation. Or please just unmute and let's talk through it. What are some of the initial things that hearing the Continuum of Care report, the identified systems gaps, what does that ignite with you? Does it seem spot on? Does it seem like it missed the mark in any area?
This is Elaine in Sioux Falls. I think a really important piece is the building of communication, not just sending it out, but the back and forth as these work groups and systems and waivers are developed. I think the report and the response really speaks to how important that is if we're going to really be a person-centered kind of a system. So I think the report's spot on in terms of the communication, and you've already started with those activities.
Thanks, Elaine. It looks like we've got a question in the chat too from Brenda. So specifically, what population do you mean when temporarily get from a CSP? So Elaine, are you talking about the recommendation to have the ability to work with a CSP for providers in home services?
Yes, I guess I was confused are that people who are on family support that don't have other providers or?
Yes, so we have that service, you know, the in-home service right now, most commonly in the family support waiver. So we will look at exploring it as an option there, but that doesn't mean we won't also explore it otherwise in choices.
Okay.
What else?
So one of the, I like seeing a lot of the life course framework and principles in the, and this is Brenda, in the, in your presentation. And one of those principles is always having families and self-advocates at the table at the development of policies and rules and that sort of thing. So when you mentioned you were going to start a work group of providers, will that include families or self-advocates from the get-go too?
So that particular work group, and I might need a refresher which particular section I was talking about. I'm so sorry. The rate work.
Yes.
Yep. So right now that is exclusive to providers. There are there are other work groups that have different stakeholders, but I'm always open to other conversation with how can we expand on that. So we could absolutely look at that, Brenda.
Okay. I just think it's important not to just react to what has been developed, but to be at the table.
Yes,
I think
and
that-
I agree. Again, that work has not started yet, but once that does, we will explore that. So if there is interest in that, please let somebody within the division know, whoever your contact is, and we will be sure to include that.
Okay. Thanks.
So we have another question. This is a lot to take in since I've not seen the report prior to this. It seems many of these areas have been ongoing needs or areas that DDD already had on their radar. It is nice to see DDD has pulled together some general priority areas, and I look forward to seeing how these efforts progress. And some agreement there.
Perfect. Yes. So what's going to happen next is we're going to go into those smaller groups. And so we'll talk more specifically and guide that conversation through in response to what we just went through, because I agree, is a lot of information. And if you haven't seen that report before, it can feel very overwhelming. So we will talk more about that in our small groups as well. Julie, are we feeling ready to move into the small group discussion?
Yep, I think we are ready. Okay, so just to sort of set the scene for our breakout rooms, I want to make sure that, you know, we have a really diverse group today, and just to kind of set some ground rules and expectations. So because we're going to be reporting out and getting some feedback from the groups, please make sure that in each group, like I said, you'll have a facilitator in your breakout room, but select someone to take some notes and someone to share two kind of high points that were discussed in your group. It doesn't have to be the same person. It could be the same person, up to you guys. But just make sure that those two roles are covered. Please, you know, use rounds. Your breakout host will explain what rounds are and try to facilitate so everyone has an opportunity to share their thoughts and uninterrupted with others listening attentively. Always maintain respect and be solution focused. And like I said, because we have a pretty diverse group today, please, we don't all agree on everything. Of course, that's what makes the group, that's what makes the conversation good and rich. And we can get a lot out of it, but just value the perspectives of others in your group, even if they are not that of yourself. And if you have a question or concern that's related to your personal situation or something that's very specific, please contact DDD and we can, you know, talk through those specific situations. We want to be respectful of your privacy and confidentiality, of course, at all times. So wanted to kind of cover those, and we'll spend 15 minutes in the breakout rooms. You'll get a notification, I think 30 seconds before you get kicked out and back into the large group. If by any chance someone is left hanging in this main session, we will get you assigned to a breakout room. This is one of my first times assigning people, so we'll see how it goes. My fingers are crossed, double crossed. I'm going to send everyone to your rooms. It might take a minute before you appear, but here we go. Jamie, when you advance the slides, you're going to see the questions that I forgot to tell everybody and tried to broadcast in a message. So we can probably go ahead and skip right on by that one. I think we've got, it looks like we've got everyone back. So we'll go ahead and start reporting out. I'm just going to ask for the facilitators to if you as a facilitator are going to report out, or if you had a specific volunteer who's going to report out, just ask for volunteers to start that, and we'll make sure that, I know that there were 10 rooms, so I'm going to just keep count and make sure every group is represented.
So Julie, I'll volunteer our group to start, and Brian agreed to take notes and to report.
Okay. We were group number 2. Some of the things that we were excited about are those things that are going to increase capacity in rural areas, progress with transportation, in-home services, and technology as well. Those were one of the areas that people were excited about. And then for a second thing to share for concerns or barriers, the workforce issue, whether you're a CSP or you're a family on family support, or an individual on family support looking for providers, that workforce is just going to be key to getting a lot of these things going. And we see that as a barrier that needs to be addressed going forward.
Thanks, Brian. Okay, next.
This is Elaine.
Thanks, Elaine.
And I don't know what number our group was, but Jennifer Gray is going to report out for us.
All right, our group, some of the positive things related to training and having some expertise and consultation, as well as we appreciated the communication and overall just back and forth, the feeling like people were listened to, not only in the report, but also in the future, hopefully with the development of and the working of this action plan. And finally, when it came to crisis, the idea with the private ICFs, the small community-based option being there for people, and that we continue to talk about that continuum of moving that ICF level of care to community-based. That discussion led to us talking about challenges and obstacles, and continuing to be just maybe some full lack of understanding of what exactly is happening with those regional centers, and how exactly crisis service or what that future of those services look like for providers. And so some additional communications about that for this group in the future would be appreciated.
Okay, thanks, Jennifer. All right, next group.
I'll volunteer our group. Heidi was going to report.
Thanks.
Yeah, so we talked about a lot of the same things people have already mentioned. Specifically talked about the topic of building some capacity to support those with behavioral challenges. That is definitely a good thing, and something that I think our group is happy about or excited to hear more about. In the same breath, it also led to the conversation about workforce challenges in our field, especially at all of the CSPs, and that being something that may be missing from this document or from this information, is that, you know, the workforce just isn't available. So how do we build the capacity to support the behavioral challenges when we're really struggling as is just to hire the staff for the positions that we have at this time? So that was something we talked about. We also talked about we were pleased to see information about transportation and technology being included.
Great, thank you. All right.
Julie, we were group 7, and Liz is going to report back.
Yes, I can say that our group had a lot of the same conversations, it sounds like, as the others, staffing being our #1 concern, but very excited to learn more about the technologies that are out there. We know that our staffing shortage is not going to change anytime soon. And so we need to get a little bit more creative, hopefully, with the resources that we have. We understand technology can't replace human beings and contact and all of that, but it can certainly help people live their best lives without having maybe a staff present all the time. We also talked a lot about, again, transportation and how we're really looking forward to seeing how that plays out in some of our smaller communities where there's not public transit. So that is something that they've struggled with for some time. And I think even in Sioux Falls, we struggle with it, even though we've got that public transit. And then in addition, behavior, and really talking about how there might be opportunities where there are gaps in our Family Support 360 program, where families are really unable to provide that behavioral support for their loved one. And so trying to work towards some sort of respite or relief or additional training for those families so that they have the tools they need to support their loved one in the home.
Great, thanks, Liz. Who wants to go next?
This is Kiri. Our group can go next. Sorry, Brooke. And Tim has volunteered to report out.
What I enjoy about going later, because I can just kind of piggyback off of what everybody else has said. There's a lot of those same concerns that are coming up for everything from the transportation. Folks are both happy and surprised. Technology, same thing. Some people were surprised that we're looking at more implementation between the CSP and the family support program and kind of being able to utilize services off one another. The workforce crisis, definitely a frontline concern for everybody, even though we were happy with some of the legislative action that was able to bring some wage increases. It still just continues to be an ongoing and concerning thing. Also, for concerns, or we're hoping to see more of, from an outside referral source such as myself, looking and referring people forward, whereas I would like to have seen like something on shared living on the docket too. Like where is that? A couple of years ago it was full steam ahead with it, and now it's kind of on a back burner, I guess. And if families are asking about it, what do we say with that? And also, the family support services as well. What do those look like as far as what can they do? There's been families that have shared with me that they felt that they were able to have their loved one move into a group home setting quicker than they could get on family support or on shared living, which seems to be contradictory to like the vision that our state has. And so there was another concern as well, that those weren't in that itinerary, I guess. So rural areas, we're happy to see that those are also being looked at, being a small town person myself. So that's all we have, unless I missed anything, Dixie.
Nice job, Tim. I just want to add one more thing that came in after we got cut off. That happens a lot in my group. Sorry. That the co-payment, they would like to see the co-payment removed for choices as it is in Family Support 360. That would be a priority that they would like to see for the future.
Okay, thanks. Brooke, you want to go next? Since Kiri just slipped right in there.
Yeah, Kate will be sharing.
Yes, and we were group 10, and we're just kind of to piggyback what other people have kind of said. There's a lot of the same things. Communication was one of the things that we were all kind of excited about. Also transportation, and especially in the rural areas, it seemed like that was a big priority, especially for how rural our state is. We also talked a little bit about the workforce and how it's just not feasible right now. It's just lacking. And another excited piece that we had was the behavior consultation services. That was another one we touched on. One of the main obstacles that I thought kind of that we had was services is just the uniqueness of our state. Services in one side of the state can be completely different than services on the other side of the state. And then just the ruralness and how some areas do not have even, basic things, anymore, like cell phone service or, even your basic utilities. So that was one good obstacle that was brought up. And then also some of the other ones with transportation and like after hours and availability was also some of the interesting ones that were brought forward.
Thanks, Kate. Okay, Jamie, who is going to report from your group?
I believe it's me.
All right.
So the group was excited that this is actually happening. So that was exciting. Things that were brought up as, of course, I don't know that they were more that they're excited that transportation and technology were being addressed, because both of those are things that are widely needed. And of course, the workforce issue did come up also.
And I can speak for our group. I don't know what number we were, but similar themes as have already been discussed today. I'm excited about, expanding supports like companion care, but concerns for staffing crisis. I'm excited about state trainings, particularly for challenging behaviors. Very excited about increased communication efforts and listening sessions. So that was pretty much it, and common themes as everybody else has presented.
Great, thanks, Jenna.
I think I might be last.
I think our group and your group, but you go right ahead.
Okay, all right. Well, we had a lot of common themes, as everyone else as well. We're excited yet curious regarding transportation and how that'll work in our rural areas. Also would like more clarification regarding the ICF and what those services are going to look like.
Great, thanks, Kim. So I'm going to look to other group members of the breakout I joined. I stayed a couple minutes late because I was making sure everyone else got safely into a room. So Kayla, is that you?
Yeah, it is.
Excellent.
So I will talk. I failed as a facilitator, so I apologize to everyone. I got things a little mixed up, but just kind of like everyone else said, excited about the technology and the communication. One question was kind of brought up about how to get family, people in family support or family members involved in these collaborations. So we kind of discussed that in the next process, but a lot of the same concerns and excitement as everyone else.
Okay, excellent. Jamie, will you advance the slide? What I'm going to do here, I'm going to add the link for the Continuum of Care that is on our department website into the chat. So folks who haven't had a chance to see that can go to the webpage, and there is a hyperlink at the bottom with the actual report linked to it. One thing we wanted to talk about, we do have, starting next month, DDD will be hosting family and self-advocate conversations. And so these will be 2 identical sessions, to the point that it is possible to do 2 identical sessions with different people, but we'll be offering an evening session as well as a daytime, kind of settling the lunch hour session to accommodate both of our time zones in South Dakota, on May 19th for the evening session and May 20th for the daytime session. We just started late yesterday distributing this flyer. So this is the first page of it. There is another page that has the Zoom connection information. It'll be virtual. And so we're really excited, again, to just engage with more people who access our services and get that firsthand feedback, provide updates directly to families and self-advocates. And so we'll be starting that in May, like I said, and we're planning to do those every other month. And so sometime down the road, we may reevaluate that frequency, but that is what our plan is right now. Joey, is there anything you wanted to add about those?
No, I would just ask that if you're willing, we would welcome any help in spreading the word about these. Again, this is a new approach from the Division of Developmental Disabilities. And so as much as we can get help getting the word out about them so that they're truly valuable for families and self-advocates, we would greatly appreciate that.
We also will be posting this information on our DDD website. I believe it'll be under the division highlights section, at least through this first meeting date. And we will be reaching out to many of you will be reaching out to providers. We've reached out to DD Council, Parent Connection. So we'll be reaching out specifically and asking you to share it with families and self-advocates that you support, that you interact with, posting on your Facebook page if you're willing to do that. Just any way that you can help us spread the word, like Joey said.
There's a question. Oh, I'm sorry. There's a question. Is DDD distributing these to family members on both waivers?
Yes. Yep. For family support and choices waivers. Yep. And these sessions are specific to families and self-advocates. Okay.
We have one more question at the moment also. Are there other states being represented in these meetings or this meeting specifically, or is it just exclusive to South Dakota stakeholders?
This is just specific to South Dakota. And DDD stakeholders specifically. Okay, so as we wrap up, we do have a couple poll questions. You know, knowing that this is a new approach, knowing that this is our first go round, we will inevitably learn as we go what works, how long we need to meet, what's helpful. Already some lessons learned by me for today in the breakout sessions, and making sure that people have some information beforehand. So we'll continue to adapt as we go. Our next Stakeholder Collective meeting will be happening on July 21st. And so we'll send out an invitation with a link, an agenda, and hopefully we'll have some handouts prepared to send out before that meeting. I do have, let me get these poll questions started up.
Let me ask one question in the meantime. Will we be sending out the flyers to providers, or will they have to actively go search it out so that they can spread the word?
We will be sending it to providers.
Okay.
And Julie, this is Kiri. Will we, the leaders of each group, just gather the notes from each person that took notes and then collect them, put them all in one spot?
Yeah, good question, Kiri. Yes. So if you took notes during a breakout session, if you can send those to the person who facilitated the group, then we'll get those to Donna, who's pulling all the notes together for today's meeting, and then we'll get a summary posted on the website. So as you can see, I posted a few questions just to help us kind of get a quick evaluation from people on how we did and what we can adjust moving forward in our future meetings.
Will we be sharing the slides from the Align report and the DDD response?
Yeah, we'll likely have a PDF that we post with the meeting summary.
Perfect.
Okay, with that, we are done a little bit before we had planned. If you would, before you exit the meeting, we'll give you about 28 minutes back in your day, but if you'd be willing to share in the chat something that you appreciated about our time today, if you haven't done so already, several people have, so thank you. Something you appreciated about our time together today. After that, and after doing the poll questions, feel free to go about your days, guys. Thank you very much for your time and attention and your input. We really value it.
Thank you, everyone.